When tying a structure at depth, the steps of knotting remain the same. What changes is the way the knot is laid around the structure in a vertical orientation rather than the horizontal orientation we saw earlier. When tying at depth, pass the cord under the hook and make the thread taut. Do not apply excess traction, which would lift up your knotting board. Even at surgery, excessive traction should be avoided as it can avulse the structure which is being ligated. Since I have the up thread in my left hand, I will proceed with a going down throw as usual. When laying the half hitch down, I will apply pressure on the long end, which is the purple thread in this case, downwards with the tip of my index finger, which is nearest to me, which in this case is on my left hand. Applying traction in this vertical way will help maintain tension at both ends of the thread in a vertical orientation. With my left hand, I will now perform a coming up throw. Cross my hands and now apply downward traction on the other end of the suture with the tip of my right index finger, which is nearer to me at this point. Tying at depth while keeping the sutures taut can often cause the first tie to slip off. It is therefore more common to use a surgeon's knot for this purpose. I start by performing a coming down throw with 1 and 2 loops of the white thread around my fingers. I then pinch the purple thread and pull it across the loops. I lay this double throw down with the index finger that is closer to me at this point, which is my left index finger. I'll now complete the surgeon's knot by performing a going up throw, which is pushed downwards by my right index finger. You may wish to add another coming down throw, which is pushed down with the left index finger.